Food and Drug Administration is proposing a ban on menthol cigarettes and flavored cigars. Supporters of the move say the tobacco industry has targeted black smokers and young people with these products. Illinois Senator Dick Durbin calls it long overdue, saying in a statement, quote, "For years, Big Tobacco has added menthol flavor to mask the harshness of cigarettes and targeted these addictive, deadly products particularly to black smokers." Joining us now to discuss this proposed ban are Christina Hamilton, Illinois Advocacy Director at the American Lung Association, and Dr. Allison Arwady, Commissioner of the Chicago Department of Public Health. Thanks to you both for joining us. Christina Hamilton, let's start with you, please. How significant is this?
It is a very big deal. The American Lung Association applauds the FDA for these two proposed rules. When finalized, this will be the single most significant action taken by the FDA in its almost 13-year history of regulating tobacco products. If the FDA's proposal were the final version, this would be monumental. The rules will save hundreds of thousands of lives, especially in Black, Brown, and LGBT communities, and it will reduce youth smoking. It would also lead to less lung disease, cancer, and heart disease.
Dr. Arwady, why are menthol cigarettes so widely used? What makes them so appealing to smokers?
Yeah, so for decades and decades, menthol first has been directly marketed, especially to African Americans and to youth. There is a flavor added that can come from the mint plant, but it can also be made in the lab. It's meant to provide a little bit of a cooling sensation to the throat, and it can mean that for some people, this is the type of tobacco that they choose. Tobacco, of course, drives that life expectancy gap, and so just here in Chicago, 10 years difference between Black Chicagoans and white Chicagoans for life expectancy. And we estimate that 2 to 3 years of that gap is driven by tobacco. So I agree that doing what we can to really eliminate some of that predatory marketing is important. And for us here in Chicago, we're all about trying to have people live longer lives. And so taking those flavors out of tobacco is a big part of helping people who want to quit.
And Christina, what has been or what is both the human and the financial toll of smoking and tobacco use on our health system?
The rate of new lung cancer cases, which is lung cancer is commonly caused by tobacco use among Black Americans in Illinois, this is an example, is significantly higher than the rate amongst white people in Illinois. It's about 75 per 100,000 versus 68 per 100,000. As Dr. already mentioned, there's a 9-year life expectancy gap between Black and white residents in the state. Nearly half of Latino smokers use menthol cigarettes. Menthol cigarettes are more prevalent amongst the LGBT community at 49%. We also see thousands of tobacco-related cancers and chronic diseases affecting many communities of color. So again, the health effects of this rule are tremendous.
And Christina, what do we know about how the tobacco industry has targeted Black people and younger smokers with these products?
The historic targeting of Black communities and youth by the biggest tobacco companies is documented back to the 1960s. The 1998 U.S. Surgeon General's report showed that the tobacco companies were depicting Black people in the media in these very positive lights. They were radiant and joyful and looked successful. And this was the time when the pervasive images of Black people in the media were negative. There's also documents from the tobacco industry that show that hooking individuals when they're young, the youth, that also adds to a lifelong use of tobacco products. So we know that these predatory practices have been going on for decades, and they really were successful in getting young people and Black smokers hooked on these deadly products.
Dr. Arwady, should there be other smoking cessation initiatives that come along with a proposal or a ban like this so that users don't just turn to another tobacco product?
Yeah, well, one of the exciting things here is that this helps potentially close some of the work that we've been wanting to do. You might not know that Chicago was actually the first place in the world to regulate menthol at any level back in 2013 when we limited the sale of tobacco products that were flavored within 500 feet of high schools. Last year, we took some action there around flavors, again, in vaping. It's really the flavors that we're focused on. So, of course, there are resources for smoking cessation, and we would love to have this opportunity to lift up, those offers. There's a quit line for Illinois. We can send supplies. I'm a primary care doc, and I love helping people quit smoking. Often it's the flavors that get people started, and it's the flavors that keep them going. And removing the flavored option here would, I believe, have a significant impact on people's ability to quit. And we know that about half of folks who smoke menthol tobacco right now say that if the menthol was not available, that alone would be an incentive for them to want to try to quit.
Christina, we know that the FDA has, tried to ban menthol several times in the past. Advocates have been calling for it for quite some time. Why has this been held up until this point?
Well, under the 2009 Family Smoking and Prevention Act, that gave the FDA authority over tobacco products. After the FDA received that authority, they ended the sale of all flavored cigarettes except menthol. That is due to intense lobbying efforts from big tobacco. Billions and billions of menthol cigarettes are sold every year. It's a huge portion of their market share. So we are very proud that 13 years later, after the FDA received this authority over tobacco products, that they are finally making that move to remove these cigarettes that should have been included in the end of the sale of all flavored cigarettes 13 years ago.
Christina, is there any concern that a move like this could have unintended consequences, like a black market on these types of products?
Well, the FDA's announcement is targeted at the tobacco industry. It doesn't penalize or criminalize the behavior of individuals, and we really want to make sure that we emphasize that this is about stopping the commercial manufacturing, distribution, and selling of a tobacco product. We also want to remind folks that FDA cannot and will not enforce against an individual consumer possession or use of menthol cigarettes or any tobacco product. If we support individuals who are addicted to these products, long term, we will see that fewer and fewer people will be seeking out these products as long as we have the support to help them to quit.
Dr. Arwoody, we're almost out of time, but I wanted to ask while we have you, your office, along with both state and federal environmental protection agencies, have agreed to a study of air pollution on the city's southwest side at the request of residents and activists there. What is next for that, and what can we learn about how better to protect the residents there?
Yeah, so actually Mayor Lightfoot had called for us to work on this cumulative impact approach last year. And when we got some additional funding with the American Rescue Plan, Chicago Department of Public Health said this is a really good use of additional funding. So this is a long process to do well. It has taken years in many other cities, but it's really looking, as opposed to at an individual permit, how do we make decisions as a city about how to make sure that we are protecting human health and the environment. And so we'll be working to bring in experts. We'll be looking at a lot of data, but it will be a citywide approach to really looking cumulatively at how various polluters can impact air pollution. And so that's the big picture on the outside, and the kind of news today from the FDA is what helps also potentially on an individual level protect respiratory health.
All right, and we look forward to hearing more about that when you all are ready to share. For now, we'll leave it there. My thanks to Christina Hamilton and Dr. Allison Arwoody.
Thank you.